2018. It's the last meeting of CPH. We'll have the pleasure of having Sigal as our head of the department. So, I don't know, I didn't really prepare any remarks other than to say how magnificent it has been to work with you for these last several years.
Yes.
That we've served. This group has served. You've been a magnificent, truly magnificent director of that vision, which you've been able to move forward, which is unusual and fantastic.
And you were patient.
And you're a great.
I'm patient. That's not a word I use to
No, I
describe
mean,
it.
like, you did all the stuff.
You know, thank you.
Yeah.
Just a remarkable leader.
Yeah.
Brookline is better off for having had you here for these last several years. So we look forward to continuing with you in whatever new role you take.
Thank you, and it has been very difficult and very unexpected. I feel a little unfinished, very unfinished with many projects going on. But I do feel like leaving it in a better place with an amazing team. We're going to hear from some today, so I feel like leaving Brookline in a good position.
You really have to like this. And you've also helped us organize ACPH in a way. I think we have greater clarity of our role. And we've done annual assessments. It's really been remarkable. All right. Well,
And the community work, community assessment work.
Yeah.
Really pretty impressive. Very impressive. Sort of ability to bring people together. Very impressive.
There was just, something crossed my inbox today saying public health agencies need to be involved in the community. They need to think about all these broad things. I think, been there, done that.
That's what we're doing. We've got a whole plan to do it.
All right, well, let's move on to the agenda. I do want to welcome David. Thank you for joining, our select board representative. It's
Thank you. Glad to be here.
a pleasure to have you. Thank you. So I think that was the major announcement, which I think everyone was aware of. I don't have any other updates. Not hearing any other announcements, we will provide opportunity for public comment. And I know we have the pleasure of a member of the public who's here today to comment and to perhaps put something on our agenda that we'll be able to address going forward. So, Anne?
Hello, everybody. My name's Anne Greenwald, Brookline resident, and I am a former town meeting member and also was a nurse, registered nurse for 40 years, and my last 17 years I worked as a school nurse in the city of Boston.
Oh, nice.
So I have a lot of public health experience. And I'm here tonight to open a discussion with Brookline about endorsing these bills that are in the House legislature right now for a single payer healthcare system in Massachusetts. Our representative, Tom Tolo, happens to be on the Healthcare Finance Committee, and he has endorsed this bill, co-sponsored this bill in the past, but this time around he's not co-sponsoring because he's on the committee and he says yes, he's in control, but he's actually in a coalition with other people who are supporting it. Aside from all of the reasons why single payer healthcare makes a lot of sense in terms of providing comprehensive healthcare for all residents of Massachusetts, basically from prenatal through death. It's and that it includes dental and it would include vision and lots of things that people don't actually have access to at all, even if they have healthcare. There's also a tremendous amount of cost savings and efficiency in having a single payer system in terms of lowering a lot of administrative costs. There's a calculator. I have a lot of websites and materials and things, but I didn't really know how to send them to everybody. But there's a calculator that says how much each city or town would save by having single payer healthcare, and this was done in the one that I saw was done in 2023, fiscal year 2023, and Brookline would save about $24 million on healthcare insurance costs of employee healthcare insurance. So that's a huge lot of money that could be used for a lot of other things, which, you know, Brookline's always got a lot of things it wants to fund, but it doesn't. That's the main things I wanted to say. Quite a few cities and towns have endorsed this. Most recently, Northampton on June 6th endorsed. Amherst has endorsed. Many cities and towns have endorsed over, because this bill has been presented quite a number of times at this point. And it never has made it out of committee. So I think that, you know, they're trying to see if we can get it out of committee this time so it can be voted on. The other thing I want to say about it is that we all know that there's a real threat of a lot of federal money being cut in Medicaid and Medicare. And I have to say, I am not a finance person, so I don't 100% understand all of this, but it looks like the savings that we would get from voting to have a single payer system would far offset the cuts we would be getting from federal government. So that this would be actually a time to be very protective of the healthcare in Massachusetts. So those are the main things I wanted to say, but I sort of wanted to think about asking you as Public Health Commission to think about whether you would like to endorse this, whether you'd like to look into it. I'm thinking about a resolution for town meeting, for the November town meeting, to ask the town to support this bill. So that's it. Happy to listen to questions.
I think one of the challenges, I guess, to single payer has come from unions. I'm not sure if even within Brookline, do we have unionized employees in certain departments or so who already have a negotiated benefit. And they might claim that, you know, again, against a single payer system, would that benefit in comparison be diluted, be somehow weakened versus what they believe they have today? I don't know, but that just might be a test case to see just within that subset of town residents and or employees, whether, you know, would that withstand a challenge from them?
I don't have the answer to that, but I think that they would not lose health insurance coverage. They would still be getting, they'd be under the single payer plan. So one thing is that the cost savings, I said the cost savings to the town, there would also be cost savings to individuals. So people wouldn't be paying as much into their health insurance. Most unions, I was a member of the Boston Teachers Union for many years, we pay into our health insurance. That's not free.
Right.
So we would be paying less than what we were paying as, you know, through the union.
But that assumes too that whether it's an employer or a union that might collect or so, or helps to subsidize the differential that employees or associates pay in, that we actually realize those monies actually come into the town and or the state to be able to offset what you're assuming is be the federal cuts that might be coming. You know,
Yeah.
and somehow someone's got to be able to make that transfer of funds, you know.
Yes.
So that
There's
you
a
realize
lot of
those savings.
so one of the websites I have is about the whole financial package and how it would work and how the funding would work, so that but basically people wouldn't be paying it for individual health insurance, and people wouldn't be paying co-pays and paying for drugs, stuff like that. So but there would be a tax that they would pay into, but the tax would be a progressive tax, so it would be more beneficial to people of lower income, and it would be less than what they're paying annually for healthcare. So, but that doesn't answer the union question.
No, go ahead, Doug. My question's probably working.
Well, I'd love to hear more about the specifics of the bill. what it means. Is this saying that Massachusetts would basically replace Medicaid and Medicare with the universal health plan?
Would-
as well as commercial plans?
Yes,
So
Yes.
Medicare would no longer be in place
So-
in Massachusetts?
I think that it would be included. Like I said, this is not my strong point, and I'm also just recently getting into this, but the bill is 35 pages long, and you have to read
Sure.
it.
Well, here-
What's the name?
It's
there's-
called an act establishing Medicare for all in Massachusetts.
Medicare would be perfect. So I was wondering, are there states that do such a thing? No, or no.
Well-
Vermont tried.
Right,
But
and
currently we
they
don't.
did a good effort.
They did a good effort.
Yeah.
I know.
Yeah.
Right, like we would be like
We would be the leaders.
blazing
yes.
a trail into the
Yes.
uncharted snow or something, but mixed metaphor, but
Yeah.
you get the idea. So why did it not work in Vermont, do you know?
Well, they didn't actually get all the way there, so it's not like they got it and they failed.
Okay,
But I will say that, we have been the leader in, we were the model for the healthcare, Affordable Care Act.
yeah.
And so, this would be again, the model for everyone else to follow, basically. But yes, it's uncharted in
Yeah.
that sense.
Jim, it does say I think we obviously need to study this.
Yes, exactly.
There is a line that says the trust shall receive all money paid to the Commonwealth by the federal government for healthcare services covered by the trust. So presumably that includes Medicaid, but and Medicare. Elsewhere, it sort of says, except anything where there's federal preemption. So I didn't know whether federal preemption includes it says we would seek waivers and stuff like that. So I also
don't
don't
wanna
know
be
how
like a
ERISA.
naysayer, but like Medicaid doesn't pay that much. Like Medicaid, it.
Actually, this
but like,
Medicaid
No, it
pays
doesn't.
if you don't have it, if you have Medicaid. Pretty good.
No, but I mean like hospitals are,
Oh, yeah.
but maybe I shouldn't go there because this is being recorded, but it, like, part of what Blue Cross Blue Shield and all these other plans are subsidizing is Medicaid patients and all. At least I know in children, maybe they pay more for adults, I don't know.
It's a complicated
Yeah.
issue, and because in Massachusetts, about a third of the money goes in indirect payments directly to hospitals without being for services provided
Yeah.
directly. So we always talk about the Medicaid fee schedule as being lousy. But the reality, that only covers about 2/3 of the money going to Medicaid. And hospitals are getting subsidies, including, by the way, hospital shortages.
Yeah.
Which they don't ever advertise
They don't,
at all.
but they
don't
have
even
that like
acknowledge,
the community
basically.
thing, they talk about the, like, they have
Community benefits.
the community funds and that's
But
part of,
it's paid for.
yes,
That's the point.
they're getting that.
But I think this bill, I mean, the importance of it is presumably Massachusetts would still be required to follow Medicare rules if we took Medicare money.
Mhm.
And similarly would have to follow Medicaid rules to Medicaid money. So playing that out would be really interesting to figure out. The Vermont thing, as I understand it, and I'm not an expert, was really partly money. That ultimately the financing was much too high a cost to the state to put the money in. Now, I don't remember how much they were replacing Medicare in Vermont, but
Vermont did such things as have home visiting to keep people at home. They did a lot of coalitions that worked.
absolutely,
Yeah.
absolutely, many good things.
Yes.
Housing things.
So I think the question, so Anne, thank you very much for
Yeah.
bringing this to our attention. So obviously we'd have to study this and maybe we could consider it at our September meeting once we've had because we're not likely to meet during some. But we could if needed.
So
do
when
we-
is this
Do
coming
we
up?
have anybody who's interested in being like a subgroup or a work group, and we have to make sure maybe we can have a staff member part of it so that we're still meeting open meeting laws. Anybody want to delve into this more deeply and maybe bring back in our next meeting a recommendation about whether this is something ACPH would want to endorse?
I'd be glad to work with Anne on it.
Great.
Yeah, I mean, would it be still though something that town meeting would see first and then we would in effect react to the resolution that they construct relative to the act that I guess is being referred to? If it's still an open, or is it an act that will have to be in effect resubmitted in the next government?
We're in the midst of a two-year
Two-year
legislative
cycle.
session,
Okay.
so the session continues until June of 26 or
So you have a reference point.
so we have time before this, whether, again, we are appointed, we advise the department and we're appointed by the select board, so I think we'd have to find out, but I don't think we can write a letter saying, as Pittsfield Board of Health did, saying ACPH endorses this without at least communication with the select board about it, because again, that's who appoints us. They're the appointing authority. But we can still make recommendations to the select board about this, and again, if it's going to be in town meeting, that would also, inform any comments that we make at town meeting. So Shira, that's great. You'll happy to work on this with Ann. Anyone else want to take a look at it?
I'd be glad to if the budget reconciliation is taking place.
Right.
If it hasn't gone so.
Okay. All right.
I'd just add that there is a general email address to acph@brookline.gov. If you send it.
Oh, okay, I can send all those things.
Thank you.
Terrific. Thank you for bringing this very interesting bill,
Thanks for
very
coming.
important topic,
Yeah.
highly relevant to our work. All right, the next item on the agenda is approval of the minutes, which were in the materials. So we have a motion to approve the minutes. Tim
We all say yes.
moves, Glenn
I think we're all
seconds, all in
saying yes,
favor?
no?
Yes, okay, any opposed?
No.
All right, good, no abstentions. All right, the minutes are approved. All right, let us hear about substance use prevention.
It's good to introduce yourselves since we have a little presentation. Perfect. Actually, can you join Zoom? Because Zoom won't be able to see it this year. Oh, yes. And then share your screen.
Thank you.
Alternatively, you can always email it to me. I can share it because I'm already in the meeting, whatever's easiest.
Perfect.
Thank you.
We did inform Jesse about this. He's not
Yes.
able to join us.
Yeah, I forwarded in the invite.
Thank you. Thank you. Thank you, everybody.
We can set up a recording. We're excited to hear this presentation in its own right because we want to hear about this important work. This was triggered in part by a request from Jesse Hefter on the school committee, who raised concerns, I think, about vaping. And we thought rather than narrowly focus on the vaping issue, we wanted to hear more broadly about the work that we're doing, the department does, in coordination with the schools about substance use and substance use prevention in the schools. So, terrific.
Should we just introduce ourselves?
Yeah.
Okay.
Sherry.
Okay, awesome. Well, hello everyone. My name is Layla McGeorge, and I'm the Substance Use Prevention Coalition Coordinator for the town of Brookline. I started in November, and we're really aiming to revive our Substance Use Prevention Coalition in the town to focus on substance use prevention, but also substance misuse prevention across the lifespan. And there we are. So yes, that is my role.
And I'm Riley Ellis. I'm the Regional Tobacco Collaborative Coordinator. So I work for Brookline as well as 6 other communities. I met you all, I believe, in January. So I'm going to be talking a little bit about the kind of enforcement side, at least for tobacco products here in Brookline.
And I think worth noting is the coordinator for all this work is Abby Dean, who you've all met before. Couldn't be here tonight. She had some scheduled time off, but she helped Layla work on this and is obviously heavily involved in all of this work here with us in the department and across the schools.
So this is just our loose agenda. We gave introductions, but we'll talk about school policy and some recommendations. Riley will talk about tobacco enforcement and compliance. We'll talk about ideas and things that we would like to do community-wide around substance use prevention, what we have planned, and also how folks can get involved in what we're doing. And yes, these are our introductions. We just thought that it would be nice to sort of give a breakdown of what each of our divisions do. So the behavioral health intervention and prevention programs does quite a few things around substance use prevention. And we love a B and a hyphen, so there's quite a trend here. So our first one is BSIP, or Brookline Student Intervention and Prevention. So these are the clinical support services that happen at the school. So if a student is caught using a substance or having a substance on school property, they are referred to Abby Dean and her team of social workers to go through diversionary process and different activities and counseling. And then next we have the Brookline Parent Education Network, which really establishes connections between parents at the high school and hosts events and trainings on not just substance use, but just adolescence and what parents need to know, really. And then very exciting, we have our coalition that we renamed and we're reviving. So it's Be Well, or Brookline Coalition for Wellness and Prevention. And so that's,
Well.
yeah, yes, no, yes. Well, we dropped already. And that's the substance use prevention of the community. And then we have Brookline High School peer leaders. So there's a peer leadership class that Abby Dean and her social workers run that really teaches high school students about public health, not just substance use, but like sleep hygiene, healthy relationships, and then they go and interact with their peers about these topics. And then also Abby works on healthy relationships and violence prevention within the school as well. So it's just a little bit of what the behavioral health program does.
And for tobacco control for me, so I am responsible for enforcing state and local regulations in all of the towns that I work in. Which, if anyone's interested in looking up tobacco regulations, you can actually go to the town or the health department's website and go to the BHIP section, and then you'll have tobacco control and everything's found there. But you can also look them up, at least the state regulations as well, on the state's website. But part of this is going and performing unannounced inspections at all of the retail establishments in all of the towns that I'm in. So going in, making sure they don't have flavor products, making sure that if it's a 21 plus store, they're IDing everyone at the door, checking nicotine content and everything, and just making sure, mostly product-wise, that everything's kind of in order within their establishments. And then I also perform compliance checks. So I recruit youth and young adults under the age of 21 and train them to go into these establishments and attempt to purchase tobacco to see if the establishments are actually checking ID for everyone before they make a sale. And then I also work with all of my towns as well for any tobacco policies. So like the legal TAs at the Massachusetts Tobacco Control Program, I always mess up their acronym.
Yeah.
But they have some legal TAs, and every few years or so they put out some new model regulations. So I can bring these model regulations to all of my towns and their boards of health. Sit down, walk through them, show them what the differences are between their current regulations and the new model regulations. If they want to make any updates, I can help kind of guide them as best I can, and also call in some of the legal TAs if they need someone with a little bit more legal knowledge than I possess. I think that covers most of what I do.
Can I ask, so,
Can we ask
Yeah.
questions?
so our local, with Anthony on the phone, you know,
Yeah.
our unique, well, not unique anymore, but our innovative approach where, you know, people born after a certain year aren't able to purchase stuff. Are you able to, how is inspection and compliance going with that process?
So far, well. I will be completing compliance checks Wednesday with someone who's actually over the age of 21, but born after January 1st, 2000. So I did some preliminary checks with someone who was under 21, and I'll be rounding out with this person who's kind of like in that window to make sure that they're following the tobacco-free generation law here as well.
What happens if you find an establishment that is selling?
So then they are brought before a meeting with Segal if they choose, but they get a cease and desist letter, and we let them know what the violation was. There's a correlating fine for said violation,
Is
and
it a significant fine?
if it's a state violation, then the beginning for your first violation within a 3-year period is $1,000. Then it's $2,000. Then it's $5,000. And if you go past 3 violations, most towns at that point on the 4th are going to bring you in for a hearing to evaluate if they want to revoke your permit entirely within that 3-year period. And if you sell to someone who's underage, then each violation comes with a suspension as well. So typically it can range anywhere from 1 to 30 days. Most towns that I've seen typically have the first violation just set to 1 day, the second to a week, and then the third to a month for suspension of their permit.
Does this happen?
It does.
So I was gonna say, one thing we've discussed here is looking at the possibility of adopting regulations. Currently, Brookline does this through bylaw. Regulations would allow us to be a little more agile and update as the tobacco industry is constantly changing and there are new products coming online, and would help us align the fee schedule. So as Riley was describing, we can fine based on the state laws at those high numbers, but our own bylaws are much lower numbers. And some regulations, we could sort of adopt higher fees and, you know, adopt the fee schedule the state has. So there's some advantages to that. And I think we had a little discussion before, the plus and minus regulations versus bylaws. But that's sort of on the agenda, and Riley and the TAs that she described, that they described.
Think we can do to help with that? From the council?
It's just about finding the time and capacity to do it. I think
Okay.
it's been on our list. We'll get there.
So, what is being done? So we just wanted to highlight some of the things that we are already doing. I mean, especially around vaping, but generally around substances, especially in the school. So BHS has a handbook, and they also have a chemical health policy consequences sort of section in their handbook, and those are followed. Security and school deans monitor the bathrooms. Referrals are made to Abby Dean and her team of social workers. The BHS peer leaders educate and raise awareness in the schools, and they especially go into the 9th grade school building. The deans and Brookline Public Health Department meet to discuss trends that they're seeing in the school. We created a townwide coalition, if you will, to address this, and BHS and also BPEN provides these trainings and education aimed at parents and caregivers.
So have those meetings been taking place with the deans?
Yes, yeah, Abby Dean meets with them on a monthly basis, and then on a quarterly basis, Matt Dubois, who manages the school side counseling, and as well as myself, we get together and kind of talk bigger picture in planning on a quarterly basis.
And what's kind of been the vibe from those meetings?
I think they've been really productive this year. There's been a lot of learning. There have been times where deans will go in and do an enforcement, and I don't want to throw anyone under the bus, but maybe don't communicate with Abby ahead of time that this is going to happen, and all of a sudden there's a whole bunch of referrals coming in. And so that having those meetings and being able to have that communication allows for better planning, and we can say, all right, let's do some in the fall, and we'll be prepared because we know we have the bandwidth to take on those students. We talked about vaping. In fact, we brought it up the other day and had some conversations, and some of this is reflected in here. Matt and I are working on the data for the YRBS, which we're now calling the Brookline Health Survey, since YRBS may or may not exist anymore at the federal level. So it's honestly been very productive, and I think, and I don't want to go too far afield, but even the work that Scott and I did with the schools on the MOU has been, I think, has allowed us to have a better relationship with the schools and be more supportive of the work that they're trying to do.
And we just wanted to highlight this project. So we received a grant from the 84 movement, and they are an organization funded by DPH to focus on youth empowerment around the fighting against the tobacco industry. And so this grant allowed us to do a project with the peer leaders. And this is just two of their projects that we wanted to highlight. And they talked about the risks and the way that the industry targets youth and targets teens to stay hooked. And then they did like a sticker campaign and also handed out pamphlets. So yeah, it's just some of the stuff that the youth are doing.
So don't you have a yearly peer event where people go and then they break up? I've been to a few.
Yes,
Good.
yes, yeah. I think they're pretty successful. We weren't able to go this year. I think with planning it didn't align, but I've heard they're fantastic.
Yeah.
They're great events. So just quickly, this is just the Brookline High School handbooks regulations. No alcohol, tobacco, nicotine vaporizers, or controlled substances. So if a student is found in violation, they'll be placed on closed campus, as in they can't leave in the school for a minimum of 2 weeks, and then also attend drug education and counseling, which is where Abby Dean's work comes in. Also, they may be subject to suspension, so that's in school, out of school, long term, or referral to law enforcement if necessary. At the bottom here, what has been recently added is that all students that are found in a group in a bathroom get a note sent to parents with treatment recommendations. So even if they weren't the ones getting caught doing the actual vaping or using the actual substance, their parents are notified, hey, we found your child, hanging around these kids. And so just be aware that they might be using substances as well. And if they are, here's where you can get resources on that.
And I think if I might add there, Abby's always talking with us about this is a very highly addictive substance. Mm-hmm. And so her work is really how can we support children get the treatment, get information to the parents. How can we support the student that's using a highly addictive product?
I'm surprised to see school suspension in there. I thought
Yeah,
suspension was
absolutely.
sort of viewed as not such a good thing these days.
I don't think that happens. I think the first line is to go to Abby and to get counseling, but the handbook did include this.
Okay.
But definitely that is, I think, a last case. Like the first kind of thing that we would do would be to send them to counseling.
And maybe it says in school suspension. Maybe that's different.
They sit in that room and do nothing.
Is that what they do?
But I think that's less likely. I think it's really like a diversionary.
Yeah, and some of that time is with getting treatment and counseling.
Yes.
So,
Yes.
so law
lots of them
enforcement,
doing
are there
that.
particular offices that are knowledgeable? How does that work?
That is a great question. I'm actually not sure. I can do that.
I'm sorry, what was the question, Andy?
What about law enforcement? Is there someone identified who has some expertise in addiction or something? What do they do with law enforcement?
So the DARE programs, I don't know if they still have that.
So there are still meetings between the police department, the deans, and Abby's office to kind of coordinate some of this. So there have been instances where maybe a student party gets broken up and students get caught, and those students get referred to Abby's office and to the dean, so that the schools are aware.
Consequences for the parents who are not home.
Oh, yes, okay. And then this is just what some school staff had said would be helpful in responding to vaping in the bathroom. So they had said that more security personnel or staff to respond to youth who vape in the bathrooms would be helpful because the deans are very busy and they're always, they're very, very busy. Or having something like a public health intern to collaborate with security guards to do some type of like community health education with the students who are using the bathrooms to vape, or just creating programming for students who are not involved in after school or extracurriculars. So there's a gap in need for the students that aren't necessarily in a sport after class, or let's say doing theater or in a club. And they said that would be really great to find a way to engage them. So these are just some of the recommendations that staff have given us.
I think particularly that last one, and that's why I like having the team here, both sides for background in enforcement, but also substance use prevention, because on the ground level, when we're implementing, it goes hand in hand. We're using the same strategies and their same protective factors, particularly that last bullet. We know it's a protective factor, no matter what substance we're talking about, marijuana, nicotine product, alcohol, it's gonna be the same protective factors and strategies that we're gonna use.
What's the link with the teen center?
Yeah, I was thinking.
But that's where the coalition really comes in, and that's what we're really in the process of rebuilding. We've been doing a great job to set up the foundation. We hope to really launch this fall. With
And we
community
have,
partners.
yes, yeah, and we have been communicating with the teen center on ways that we can be there or how we can include ourselves and collaborate. So that is, we are talking about that with the teen center.
You know, as a mechanism for programming for those students.
Yes, definitely.
And also strategy in the chip.
Yeah.
All this work is tied into their overall shot chip activities.
So here are just some effective prevention strategies. So we are really working from the 7 strategies for community change, which is from CADCA, and they're bolded. So that's providing information, enhancing skills, providing support, enhancing access or reducing barriers, changing consequences, changing the physical design, and modifying policies. These are just like some examples of what we could do around vaping prevention. So enhancing skills, like perhaps having the peer leaders do a youth workshop to build refusal skills for like 8th graders, would build skills. If we find, so like for changing physical design, if we find that, product displays, there are vape product displays, we can work with Riley and say, okay, how do we remove those? And so I really like the 7 strategies for community change as effective prevention strategies. And these are just some examples of what we could do specifically around vaping, but also they apply to any substance that we would want to focus on.
I knew the slides coming, I didn't.
Yes, so a little bit more about enforcement and specifically in Brookline. So I wanted to talk about retailer inspections first. So I believe there are 4 stores that I will be inspecting in the next couple of weeks left, but everyone except for 1 store has passed their inspection. The 1 store in question, the DOR, actually found flavored products in the store as I was doing my field training. And I do know, to add a little asterisk here, it is new ownership at that store and no one had been in my position for quite a while. And part of my job is when a new owner takes over a store or opens a new store, I go and do new owner education to make sure they're fully understanding that all of the regulations in the state. We do our best to work with all of the retailers as best we can and make sure that they're educated and they're fully understanding what their responsibilities are. But unfortunately, flavored products were found, so they were fined. They paid their fine. The violation is currently resolved, but everyone else has passed inspections, so it's been going very well. And as far as compliance checks, as I said before, I've only done 6 so far. All 6 of those retailers did pass. Most of them did ask for ID. I think I had one that took one look at my underage buyer and said, "You're way too young, please get out of my store." But there were no sales, which is wonderful to see, and then we'll see how the rest go on Wednesday.
Yeah, and we always say our goal is to have no sales. Our goal is always compliance, going with that education first. But the example Riley gave was a violation of state law, so we did fine at the higher level, $1,000 fine.
Does that go into the general fund or revolving goes into the general fund?
So what are people vaping? Cannabis? Nicotine?
Caffeine now as well.
Caffeine.
Caffeine.
I mean, they're not drinking those bottles,
They are doing that as well, but they're also vaping it now.
but they can sell those bottles.
Yes.
Okay.
So this is what the behavioral health prevention and intervention program is having planned for the following school year. For the clinical services, Abby wants to implement I Decide, which is a diversionary program that goes into like the tactics that the tobacco industry uses, and also just different counseling aspects of intervention. And then also wanted to provide students with quick kits, so just little baggies of things that could help a student who is looking to quit vaping. BPEN, which is the Brookline Parent Education Network, wants to work with parents, especially those that are concerned, the advisory board to plan events and trainings. BeWell, which is the coalition, will utilize data from the most recent Brookline Health Survey /YRBS to plan out community-wide prevention strategies. So we're thinking some things like the Wellness Summit, a sticker shock campaign, social norming campaigns, doing environmental scans, really what we find is needed in the community to do. And then for the peer leaders, we want to work with the 84 movement. We are now a chapter in Brookline. Perhaps do a photo voice project around vaping, addressing root causes of substance use, so talking about mental health and sort of school spirit in the schools, creating vape drop boxes either in the high schools or throughout the community to drop off vapes, and then peer-to-peer education. So they really want to integrate with the middle school aged students to do some education.
What are the drop boxes for? This is after you use the stuff to drop it?
Or it's like if you are done, if you don't want to vape anymore, they're just boxes that
Like the needles?
kind of, yes, yeah, with resources typically on the box saying, you know, if you want it.
The sticker shock campaign.
Sure. So it's typically done with alcohol. So you could have like a sticker that says a message like Brookline parents don't, I don't know, I'm trying to think of like a good, a snappy one. And then
No, you're good. I know. I previously worked at a coalition in Beverly, and we did a sticker shock campaign. And so it was just reminding folks of literally the law that you can't supply alcohol to someone who's underage.
Yes.
Some of them are that simple. Some of them
Yes.
are like really snappy.
The coalition I worked with previously, it was like it was quite a long sticker, and we encouraged people to put it over their like liquor bottles, so you would know if your child had opened it or something like that.
Right.
So it's really just a campaign, and it doesn't necessarily have to be in liquor stores. You could put stickers on like pizza boxes or like takeout bags to spread the message that, like, especially for parents, your job is to not give your child alcohol underage. And so this can apply, I think, in different ways. It's very successful in sort of like alcohol prevention campaigns, but I would love to see if we could do something like that for vaping campaigns for the community.
Where does the term the 84?
Yeah, what is that?
So the 84, it started in the 90s because it was like 84% of Massachusetts teens are not smoking cigarettes. And so they were like, we're the 84 that aren't doing it. Now it's like 98% or whatever.
Yeah.
It's a much higher percentage. But they were like, we're the 84. And
Okay, just
Sorry, just fun fact, it has come full circle now. It's like 84% don't vape. So
True.
the number is
back.
relevant. Yeah, again.
But how would anybody know that?
Typically I think YRBS data.
And it's sort of that social branding, that social norm. So the majority of kids are making good decisions, are not using substances. And that encourages other kids to make good decisions and not use substances.
yes, and I would love to do that. And I think that social norming is such a
It's my
great,
favorite
I know,
strategy.
it's such a great idea, and it's such a great strategy to just say, like, you think as a child, maybe a lot of your peers are doing this, but the reality is most of them aren't. And it's quite powerful. And so we just wanted to share that if there are parents that are concerned, they could follow BPEN and join their parent advisory board to help plan these trainings or events around concerns that they might be having. And so this is just some information on where to follow BPEN and who to contact. And then also just like for community members, community-wide, they're more than welcome to join Be Well. It's an open coalition for Brookline. And we're really going to focus on substance use prevention and substance misuse prevention across the lifespan for community members. And so our first coalition will be in fall, and if folks are interested, they can email me.
Great. That's very impressive.
Spectacular.
Yeah, really.
And thank you.
I have a couple of questions.
Great. Go for it, Anthony.
One, it's fantastic that all the education is being done around vaping, but 25% of nicotine pouch use right now is underage. So I think this is one of those things that tobacco has continuously forced us to have to respond to, but just trying to keep in mind that vaping is visible, and now kids tend to be looking for ways to do things that are more discreet and to be able to escape. So right now, again, the data kind of shows that nicotine pouches have a high uptake for people who are underage. So just making sure, we address that in some manner. Middle school use from the YRBS data is around 3 or 4%. So that's about one kid in every classroom. I know I'm a long ways away from when I was in middle school, but we had it in 6th, 7th, 8th grade in terms of, someone mentioned DARE. But I think it's really important because, we're trying to look at the data as we try and bring nicotine-free generation to other towns. And one of the first questions they ask us is how Brookline is doing. And we often say, it's too early, but, we're going to be looking at 6th grade data because that's the biggest disparity that we imagine would show from a 25-year-old down to, what is that, like a 12-year-old? So I think considering doing that too is making sure there's outreach to middle schoolers because it is happening in kids who are younger, 11, 12, 13 years old. And then the last point is I'm curious to find out about this new business. So I suspect, at least when I've asked about stuff around restaurants, they get like a new business packet from Brookline. So people who buy a business that already has a nicotine or tobacco permit, do they get a packet that has, Brookline's laws in towns ahead of time?
Not that I'm aware of. They don't right now. I'm definitely looking into putting something like that together for all of my towns. It would definitely make my job, I think, a little bit easier when it comes to doing these new education visits. I'm going to be reaching out to one of my colleagues that covers the South Shore. She does something very similar, except she also visits and does education annually with all of her retailers. She has this packet involved and also adds like a section at the end saying that the retailer has read all of these and that they do agree to comply. And so it's just an extra level of like, you did receive this education, you've received it every year, and should a violation occur, it's another record that can be pulled from at hearings and so forth. So it's something I am looking into. Thank you.
There's no packet.
But I guess I'm trying to understand the process, which is how is it that a new business comes in, do they just get the permit from the other one that's hanging on the wall and they just start selling?
No.
So who's approving that first permit? That new permit transfer?
Yep, so the permits are non-transferable, so they would need to reapply. They do sign during the application process that they got a copy of the regulations or bylaws on the community, and then they have an education visit. So there is education that happens, but there is no packet, and I think that's actually a great idea.
But it's not an obligatory step that the education occurs prior to the issuance of the permit, is it? They just sign.
They sign that they
received it, or
bylaws.
Yeah, so it would be nice if it was like a driver's license on a car. Instead of the car, then the driver's license.
Yeah, I know, I believe it was Needham has some formal training that they issue out to their retailers on an annual basis. And again, they sign off that they've received it and gone through the training and trained their staff.
Arlington does as well.
Yeah, so there could be some more formal processes.
Is there bartenders who have to be trained every year in recognizing who's drunk and who you have to stop serving to?
Tips training
Yeah,
for alcohol service, yeah.
and who does that?
Who requires that? Our select board.
No, but who does the
does
actual
this?
Oh, it's
training?
private training, so they have, similar to how you get your food safety training for restaurants.
Right.
They go get a certificate from a private company and then give their certificate to the licensing agency.
So just going back to the Zinn question.
Yes, I was gonna say the
so-
pouches, is
yeah,
that
is
under
that-
your, like, purview?
Yes, so I cover all nicotine products as well as tobacco. And also most vaping products, at least when it comes to the flavor ban in Massachusetts, anything that is a vape, whether it contains nicotine, tobacco or not, is under the flavor ban. So nothing can be flavored if it's a vape product. But I do cover nicotine patches.
And do you have some sense of the level of use and things like that is?
I don't necessarily have a sense of the level of use outside of when I've spoke to some of like my underage buyers and kind of hearing what they see in schools, so like anecdotal kind of things. And then talking to retailers, sometimes they'll tell me certain products are popular or different things, depends on kind of how chatty they feel the day I go in to do my inspections. I do believe they're very popular. A big part of that is the fact that they're so cheap because the excise tax doesn't cover them yet because it's synthetic. I know things are in the works to get that, that they will be covered by the excise tax, but that's, I think, one of the biggest things. It's just they're very cheap, and then also the nicotine content. I will say the most recent model regulations put out by the legal TAs at MTCP are starting to address nicotine pouches, and as I've been speaking to all of my towns about updating their regulations, I make sure to bring this up. Potential things that are included in the model regulations, I think there are two ways you can regulate them. Some people are having it so that nicotine pouches can only be sold in 21 plus establishments, so adult only stores. And then you could also have it so that there's a cap on the amount of nicotine per pouch. In some of the stores, I've seen nicotine content as high as 16 milligrams per pouch. It's egregious. But they would cap it at 6 milligrams per pouch, so that would be the highest that could be sold in stores.
So is this another thing where a regulation would be helpful to us as opposed to a bylaw?
It lets us move quicker.
And should we also be proposing a bylaw in, September, in the fall town meeting if we can't get regulations by then for this?
I would say the length of the process would probably actually be easier for regulation.
Right.
I mean, maybe similar to the public comment, if you want to form like a subcommittee or a working group to get that going.
Anyone interested and willing to work on the pouch or bylaw?
Well, Riley, you're gonna be doing it anyway.
Yeah,
You'll be doing it anyway. All right.
How many towns do you have? 6?
7 total.
And you run around to each one?
Each one, yes.
And you one person?
Yes, and well, I do have a contractor that assists with my South Shore towns, so I cover, and we'll also be picking up, it'll be 8 next fiscal year. But, so there's Arlington, Belmont, Brookline, Newton, starting next year, Norwood, Randolph, Stoughton, and Watertown.
Oh.
Wow.
Andy, would you be interested in
No, not
working?
in the least.
No, I was gonna say, this is
No,
where
I
the
think
next-
this
But we
is
could
not
recruit
me.
Anthony though.
No more.
I know, I was thinking.
Maybe
the
Anthony, we
same
could pull you in on this.
Yeah, right, he's not busy.
Anthony, maybe we could discuss with you your interest in participating and helping get a regulation together on the pouches.
Well-
Sorry, Sagala, I was about to say something.
I was gonna say the whole shebang. It would be the whole model regulation, so it would be taking
Not
what we
just
already have in our
pouches.
bylaws.
Okay, terrific.
Formula, making sure the regulations align with that, and then adding anything like the fines or the nicotine pouches. It's all comes in one.
Okay,
And
terrific.
there's a beautiful model regulation, and it literally highlights you can do A or you can do B. You can do, so it's not a no regulation, an easy process, but the TA assistance makes it as easy as it can be.
Okay. Maybe we can talk Anthony, it's something you might be interested in working with Segal or with Riley on.
Yeah, I think to whatever extent the town staff has the ability to do this, I'm happy to help out, obviously.
Exactly.
I think we should be, we were ahead with nicotine-free generation, and I think this is one of the areas where it would be nice for us to catch up with other towns who have either moved it to adult only, or at the very least, we should be decreasing the concentration of
Great.
these pouches.
Terrific. And there was a third thing you asked, so you asked about pouches.
Middle
Oh,
school,
middle
the
school.
business, the businesses, because I think this person got behind the wheel, but they know what they were doing. But like middle school outreach, I think is really important. I remember when we passed the flavor warrant article, and that was before the whole state act and the state pause, is I spoke at, I think, Lawrence Middle School because they were interested in it. And the kids at that time, and this is vaping, right? They knew about that, some of their peers were doing it, and the YRBS data for us at that time, and that was 2019, 2018, was pretty similar, about 3 or 4%. It's been consistent. I don't know what the most recent one is. I think when I looked at it, though, it was still around 3%. So I do think it's really important to get this stuff down to definitely 8th, 7th, and 6th graders, that they know about it and are aware of it, that nicotine comes in different things, and the pouches, especially how high in nicotine those things are for their brains, and obviously they'll have younger siblings. I really worry about that stuff. Vaping what was a thing is a thing, but it's much harder for a 12-year-old to get that to a 9-year-old. But a nicotine pouch that's already strong, and then they have younger siblings, and leaving something that looks like a chiclet or anything like that just is not a good recipe.
Are we all engaged with the 8th grade schools and the 6, 7, 8?
So we're working on the Brookline Parent Education Network is working on connecting with middle school counselors to see how we can start engaging with the middle school students on this. And also the peer leaders do go to the 8th grade students, but we definitely could go to 6th and 7th graders as well, do some education.
Great. Terrific. Any other questions? This is really a wonderful presentation. Good work and great comments. I think we can move it forward. Good. Thank you very much. All right, so the next item on the agenda is the reports, I think, right? Director's report.
Yeah, it's a little light.
It's a little light, yeah.
I would say so. We finally have it on the books, our first steering committee meeting for the CHIP implementation. I would say since the report was submitted, we do have a select board representative with Michael Rubenstein will be representing the select board on the community health improvement steering committee. So we're excited to have him on board. You can see the rest of the members listed there, including Mary representing ACPH. So we will be meeting next week. It's Tuesday. We'll be posting that later this week. It will be a public meeting.
And then part of their task is going to be appointing the work group committees or figuring out the communication methods. What's the next step?
Yeah. So we have some ideas on the working groups. We want to get some feedback from the steering committee. And then that's where the bulk of the work actually is in the working groups. And they'll meet more regularly. Steering committee, we figure about quarterly, but the bulk of the work will be done by the working groups and then reporting up. HIRA gave us some really good systems to use. We'll be talking about that with the steering committee to see if they make sense. Red whole traffic light system to say, what's going well, what do we need help with,
great,
what's installed, and so hopefully we'll be implementing that. And then start the work groups up and running. As I say, a lot of the work is happening, like you see, like this is one of the strategies that, developing coalition and all the substance use work, but we want to make sure that it's all tied together and continues to feed up into the big picture.
Great. Good. Any other aspects of the department's work that you'd like to highlight?
I just am really excited about the Find Help. We met with the Brookline Community Foundation roundtable and kind of linked into recent town meeting warrant article too about convening all those agencies together to talk about youth. So this was something that BCF does on a quarterly basis, is they get the executive directors of a lot of the community nonprofits together. And John and I were able to go and present about our work around the human services platform. So we signed a contract with Find Help, and we started to build out that platform, hopefully launching this
Shortly.
summer.
Yeah.
You know, it is pretty turnkey with the basic self-navigation part. What we'll be doing over the summer is filling the position to assist residents with navigation, so hiring the navigator, which again, I always talk about those two hand in hand, to really be able to provide that service and connecting to social services.
How is the Find Help populated with the services? In other words, is it their job? Is it our job? Is it a joint job? How does
Yeah,
that
it's
process-
mostly it's really exciting. It's mostly Find Help. They have staff that do this full time, and so they go through. Was it biannually? I think they go through the whole database, and they're always monitoring for changes. But I mean, across human services, the platform is very robust. There's over several thousand in the Boston area that are already populated in the database, which is fantastic for us. And then we're able to highlight if we know specific partners like the
Right.
food pantry. We're able to make them like a preferred client, and so they come to the top of the list right away when you search in the database. So that's the work that we've started doing with them, is figuring out who are some of our key providers that we want to make sure people see right away, and just trying to get an understanding of the back end of the system and the different configuration changes we can make.
Share how we added BCDC.
Oh yeah, so and we also have the ability to add, right? So there's a robust database, but if there's a partner that isn't in there, DCDC has their rental assistance program
Right.
that wasn't in there. So we walk through how to add, and they will go and check it. The Find Help staff will go in on the back end and check it, make sure all the information's correct, and then that will also be in the database. So
And we have the ability, so they're accepting applications now for rental assistance, you know, they're gonna be
BCDC.
very overwhelmed.
yeah,
And so we have the ability to sort of take it off when they're not accepting and keep it really live and current. Because that's the big issue with social services, right? Trying to navigate through it, what's actually accepting applications right now, and do I qualify and all that stuff. So being able to really curate the information and have it be accurate and current.
And is it closed loop? In other words, does like the BCDC folks say, if you refer Susie Smith to BCDC for rental assistance, do we find out from BCDC, yes, Susie Smith came and we were able to provide the services?
So that's sort of phase two, and what we liked about Find Help is it had a full spectrum of how involved the community partners want to be. A lot of the other platforms we looked into, everybody had to be in the platform with a login and be, you know, putting data and having that closed loop referral. Find Help seemed to be a little more agile, so definitely community partners could be in there, get a login. There's no additional fee for them. It's all covered. It's not a license-based fee schedule. It's a flat fee, and you can have as many licenses as you want. So everybody can get a login and actually have a little bit more of that connection and closed loop. Or it could be very simple of, as long as they provide a general email, we send an email out of the referral, and they just click a box in the email to say accepted, and at least we get that data back. So there's a little bit of a spectrum of how much we get back, but the metrics are a huge part of this. And also tracking what type of services are we, you know, is being requested. So I think there's gonna be a whole lot of really interesting data that comes out of it. And I'm hoping it sort of snowballs as we get more and more communities more and more involved, and it becomes this big platform where there's a lot more closure.
So will that be like almost a top of the bar, like button bar or something like that on the town's website, and this new Inhabit app that the town is pushing? I mean, in terms of someone being able to see it almost right away when you.
Yeah, I mean, we gotta come up with a whole marketing strategy, work with our website developer, make sure it's pretty, you know, pretty well highlighted on the website. And also, I feel like a lot of resources repeatedly pushing it out, because nobody's really gonna pay attention until they need it. So it's gotta come in front of you when you're looking for it. You know, I don't know if people go to the website, but it's more about the Inhabits and the social media and the, you know, making sure it gets out there and in front of people. Lots to do.
yeah, for sure.
Told you, a lot of unfinished things.
Yeah. Any other business, any other ideas? This was a great meeting. Anything else? If not, we'll Any questions, comments from any members? If not, I'll entertain a motion to adjourn. All right, here we go. All in favor, thank you very much.